Good evening. Welcome to the webinar series organized by the Ethugalpura Finance District Road Crew. And thank you all for joining us today. Today, we're presenting on life-saving skills presented by Mr. Samith Thilina, who's the Senior Instructor at Sri Lanka Life Saving. Before we starting, just a reminder, if you have any questions during the presentation, please type them in the chat option given in the chat box. Samit, over to you.
Sorry, thank you, Lakindu, and it's been a great honor to speak to you guys. It's a great privilege. I'm Samith Thilina, representing Sri Lanka Life Saving as a senior instructor. So today, our main point is to speak about life saving and how to do it, and what is the major requirements once you come as a life saver. Actually, this is an initial stage, so you guys need to grow up more, but this is something that you need day-to-day life at your work area, at your home, or on the by road, whatever the place that you are. So this kind of skill is greater to you to save another life or support someone to save another life. So I'm basically into water. Water is one of a major resource in Sri Lanka since the history. The Sri Lanka is one of a country, it majorly based on water, surrounding the sea, and 106 rivers, more than 30,000 lakes inside in Sri Lanka. So we are so relevant to the water. So this is where I'm coming, the Sri Lanka Life Saving. Sri Lanka Life Saving is one of an historical, and it's in a 1947 established organization to prevent water. So before I going to speak about the life saving, today our main topic is CPR, cardiopulmonary resuscitation, how to give a cardio support a person who required it, who need it. So before I want to speak this situation, so I really like if this is can be an one-on-one discussions, or if I can discuss with you guys, but there are some restrictions, so I don't think that I can talk to you, but you guys can give up any questions to the moderate team. So before I start CPR, I want to speak water safety and drowning prevention and water safety, or prevention or precautions, because before help someone, a disaster is the last section that we need to act earlier. If we can reduce that disaster or that symptoms or that accident, I think prevention is the most important thing. So I will take you guys throughout and a small video how we need to prevent in the water, or how we need to prevent or take precautions before we face an accident. So I like to share a small video with you guys. This is a very simple video, and it's really it's a very cartoonistic. So time to time I like to speak with this video. So let's go through with the video.
Hi, everybody. I'm Kim, and I'm here to talk about how to be safe around the water. Many people are hurt or even die when they get in trouble in the water. In fact, over 500,000 die each year worldwide. Drowning is the second leading cause of accidental death worldwide. Most accidents happen in ponds, lakes, and rivers, but they also happen in pools and even in people's houses. I'm going to give you some tips to help keep safe. If you're not a great swimmer yet, be sure and swim with an adult. If you're a good swimmer, be sure to swim in areas with lifeguards, obey all safety signs and warning flags, and ask the lifeguard about the safest place to swim.
If there's a yellow flag flying, it means you need to be very careful. If there's a red flag flying, it means don't go swimming. To reduce your risk of drowning, never swim after eating heavy meals. Don't swim alone, swim with a friend. Pay attention to signs. Don't swim at night and remind adults not to swim after drinking alcohol. Don't try to swim beyond your ability. If there are currents, stay out of the water because they can sweep you away. Don't be macho. Whenever you see someone in trouble, call the lifeguards or other emergency professionals for help. Don't go in yourself. Many people have died trying to rescue others. Always enter the water feet first so you protect your head and neck, especially if the water is shallow or you can't see the bottom. Always use a life jacket when boating, even if you know how to swim. Look how much trouble this man is causing himself by not wearing a life jacket. Luckily, he's okay because his friend was wearing a life jacket. Your life jacket fits correctly if you're wearing it tightly and no more than 4 fingers can fit between your shoulder and the shoulder of the life jacket. Know the weather and water conditions before getting in the water, and if you hear thunder, get out of the water.
There are many places with water in your house that can be dangerous for very young children. Keep the lid.
Now we're going to see what are the things and places in your house, things what you maybe you know these places, as well as you have a small idea, okay, there are the places that how the water contains at home, but most of the time we never think these are become a disaster because to be a trouble or incident from the water, this much of water is enough. This much is so enough to become a water accident.
The toilet and close the bathroom door. Stay away from any kind of water ponds and areas with water. Any type or amount of water can cause drowning to little kids. Keep your house safe. Avoid leaving toys in and around the pool that can cause little kids to reach for and fall in. Vent your pool on 4 sides with self-closing, self-latching gates. That can decrease drowning by 50 to 70%. Always turn off the pool engine while using it. Don't make a game out of holding your breath. It can be dangerous.
I know each and everyone, most of the people who hear and take part with this session, you try this thing at least one time in your life, in the pool or river or somewhere else. This is each and everyone, everybody, according to me, each and everyone in the younger age or still, we try this thing at least at a one time in our life, at least one time. So these are the things what we never think, but become an hazard in our life.
Don't use inflatable swimming aids. They can lose air and will sink. Always use a life jacket. these tips and you can.
Most of the time we using inflators. If you can't swim, according to the lifesaver, so my recognized water level is until your hip. That's all. Until your hip. You can't go further if you can't swim. Even if you are a swimmer, you can't take your a friend or your colleague or your parent or anybody who can't swim more than hip level. It is the starter. That is the place where we starting to start our hazard. That's the way how without thinking small things, we starting to face, or we are shaking our hand to a hazard. So while you seeing this inflators, the inflator is an object that we can't predict how many hours there it will be. We don't know what is the quality. It is an object. It can be within a second, it can be a damage and it become an harm to you. That's why always, if you get into the water or the deeper place or any other place, it has to be a life jacket with very fixed life jacket.
Trip to the hospital. And you can return safe and happy to your home. Tell your parents about our water safety tips.
Okay, guys, those are the things that we have to think with the water. So whatever place you're going for a swim, or if you go and having a picnic or whatever, a party, a pool party or beach, a river, any other activity, whitewater rafting or whatever. So you need to think twice about your life. It's more important. First, you have to think about your life, then your bysiders and any other thing. So it's more important. So I will going to share a small slides. So we'll speak what are the things that we need to do very first if you see somebody in a hazard. So first we speak about it, then we'll check what are the things that we can do. Okay, I really like to get an opportunity to ask if there are any overseas people over here or inside in Sri Lanka. But is you have in your life, is there any of you have an accident, or have you seen in live to see somebody in drown, or have you any experience in your life of that facing for a drowning? If there is anyone who like to share your thoughts or your experience in this moment, then I can get you to the next level. Is there anyone? You can raise your hand and you can give your thoughts. It's actually, I want to say, drowning is something everyone is facing in our life. At least one at a time, we have faced it. I also face it in my life, early in my very younger life. So I face it. So after that, I was taught, okay, I need to learn what I have to do. Then I become stage by stage to this point. So in my life, I have seen so many people drown. because of the clothes, what they're wearing, because lack of the knowledge, alcohol, and the place they don't know where they are going, or underestimating, or they overthinking about their abilities. So these kind of reasons that happen most of the time to us to facing a hazard. So I like to ask somebody who like to share any kind of your thoughts or your experience in this moment until before we go to the next session. Is there anyone who like to share your thoughts or your experience about drowning? Yes, anyone, please. Yes, I think there's a one hand raised. Koneshwaran. Yes, you can speak, Koneshwaran. Moderators, can we give an access to him to talk, please?
Yes, sir, we have given the access.
So I have to give the access.
No, we have granted the access for Koneshwar.
Okay. Nusrat, yes, you can speak now.
Yeah, I had, I mean, once when I was small, like around 14, 15 years old, I happened to drown when I went to bath in a river.
Okay.
So that time, the only thing that I tried to do was to hang on someone's hand or to catch whatever things I can and come to the shore.
Okay.
So that's
So,
the very
just
bad experience.
Nusrat, sorry. Sorry for the interrupting. So, small question. So, is there anyone who know about that river, or did you, before you get into the water, did you guys check, oh, this is the best place for we need to get into the water?
Actually, I went with someone who was living nearby.
Okay.
But unfortunately, that time the current was heavy, it seems.
Yes. Okay. Right. Thank you
So
very
that's
much.
the reason. Okay.
Thank you very much for your thoughts. The current is another, it's a massive hazard. If the current, not only in a river, if you face into the sea also, there is a current that we call the rip current is the hazard. So if we have a time, I'd like to share some ideas and some tips how you need to save from current. So before going to that, I like to share another. You guys can see my screen?
Yes, sir, we can see the screen.
Okay. Okay. This is the very first thing that you have to think before getting to the water. Most of the countries, they have the lifesavers who doing life saving in the beach or any other water resources places, as well as in the pool. But if you go into the outside of the outdoor arena or outdoor water resources like sea or river or lakes, very first thing you have to think about your safety. And This is the international life-saving flags. It is come up with the red and yellow. So there are two flags always. If there are lifesavers are on duty, there are two flags, red and yellow. So you guys have to be alert about those flags, and each and every time you must swim in between these flags. If you swim between the flags, your life is always safe, because lifesaver is always watching about you or your team. And the other thing is, if you think, okay, now we're going to swim, the people can see, or there are girls with us, so some of the boys who can see these things. There are social, cultural issues, but with the water, I don't think that social and cultural issues are become the most priority. It is one of the least priority. Your safety is most priority. So always go and swim where the people are, more people are there. So it is mostly a place for specifically to bath or swim. So you have to think, and we need to take an local knowledge. You need to ask some people, is this place good to swim, or is this an hazard? Is there is anything? So you have to take that precautions, and you need to think, what is your clothes? What are the things that you need to wear? So it is more important. So what you need, what you wearing is more important when you're going to water. So those are the things that you have to think before getting to the water. So the other thing is, if you have any kind of sicknesses, illnesses, or some other unwell body for you, you no need to go into the water. It is you have to think by yourself, about yourself. So that is the main thing that you have to think. So this is general thoughts that we will think. Swim in the range, keep your head above the water, always in between the flags. If you see somebody is in getting hazard, don't, even if you can swim, even you listen to this lesson from today, don't get into the water. That is the biggest hazard. That is most of the chain of deaths. The one person is getting a hazard, then the other person who have that willing to help is jump into the water and try to save. So if you don't know the proper techniques, and if you don't have that practice, you both in danger. So first you have to talk, then you have to throw something, then we call the reach. First you need to talk without getting to the water. First you have to shout and ask him to come to the bank, try to swim. Then he have a hope to save his life by himself. Then you can find something around you, a rope or a branch, anything, or whatever. If you wearing a trouser, a long trouser, or if you have a belt on your trouser, so you can use everything. So you can remove your pant. If you remove the pant, and if it is pulled there, it is a long a supportive equipment for you, and you can take your t-shirt and your pant, you can tie up it, and you can throw it and ask him to hang on it, and you have to pull it. So this is very first thing. You have to shout him, and you need to give him an idea that somebody is coming to save you, and you have to shout and take support from outsiders, because always think, don't go for support a hazard if you are alone. It become an technically and legally support for you. If something goes wrong, you need a something support for you back. So that's why we asking every time, to ask, shout and take and help, because you don't know what is the hazard is there. Even if somebody is there, you can help more efficiently. So you can reach something, you can throw something, and you can ask him to hang, and you can pull. And the bysider, who can give you a support, you can throw something. And the other thing is, each and everyone, you know, the mega bottles or that plastic PET bottles. If you have a plastic PET bottle, a 1 liter PET bottle, you can save a life. A 1 PET bottle is so enough to save a 1 life. What you have to do, take the lid off, put the water out, cover the lid, keep that. Remember, you need to cover the lid each and every time. Otherwise, it is a hazard. So cover the lid. You can throw it to someone and ask him to hang it, and keep on your chest the bottle. That's so enough to save his life. Or you can tie up some rope and you can throw it and you can pull it. So those are the very small things that we can do. If you're going a picnic or with your friends, very small things in your place, you can manage. Take a 2-3 PET bottles and tie up and put a rod and keep it with you. It's a very small thing you can do. Don't get into the water at once. It is one of the hazard. If you don't know the place, you need to find a rope, a rod or something, or a branch, and you have to put into the water and first check. Because in Sri Lanka, the most of the deaths are happening in the lakes. The first reason is muddy water and the mud. Once you jump to the lake, and if your legs are hide on the mud, you can't come up because it is not tight. So until you struggle, you going down again and again. It become more sticky once you struggle. So the best thing is, don't struggle at the moment. That's why we asking always use up all or something, put into the water, check the flow, unless before they get into the water. Unless if you're not sure the place, don't get into the water. That's the basic precautions that you can take. And if you see this picture, you can see there's a slope. Slope is not a place that you can support anyone, because you have no balance on your body once you come to a slope. But if you are on a steady place, you can keep your foot very steady, your body is very steady, you have that balance. So if you want to help, or it is that a situation that you have to help, but if you can get into the water, first check the flow, get into the water very slowly, don't be panic. And if you think if you can't help at the moment, don't go to the help. That's no worries. Shout and take the people, take the outsiders, shout to outsiders, bring the people, ask the expertise to help. Because think your life each and every time. Your life is the most important. This is if you can swim, or if you are a proper technician in a lifesaver, or if we have a very confidence on water, but neither time go to near to a person. Don't go near a person. So this is something you need to think. If you have something floating device, you have to take to him, give it to him, watch him, but don't go near him if you are not a proper lifesaver. If you don't have that techniques, then you can ask him while you're swimming, you can ask him to follow you. These are, we call the semi-contacts, all the days they can calling it this non-contact, because now we believe the contact rescues are the least. Non-contact rescues, shout, talk rescue, throw rescue, and reach rescue. Those are the most important. If you guys want to help, you guys can use the human chains. These are the proper equipments that lifesavers using. If you see some of these equipments, you can ask for a lifeguard the assist. These are the equipments that lifesavers using, and this is a proper life-saving uniform, and this is the way lifesavers, and this is a place to go and have your fun activities at the water. Always think, if you have see these red and yellow people were anywhere, that is the most safest place. And these are the equipments. These, if you guys can see these things at the pool decks or any other places, if you see, don't think twice to use the equipment. These are some of the flags that you have to think. If there is any place that mentioned the red color flags, don't get into the water. That is the danger of place to swim. Maybe former days it will be good, because there are seasons, current seasons and the weather seasons. According to the season, the play of the sea or play of the river or the lake become hazard. So you have to think about the flags. This is red and yellow is the most safest flag. Red is the danger. And if you see this black and white, there are some water activities. There are so many flags over there. So you have to think about the flags if you need to know about those flags. And very important thing, signboards. You have to think about it. Sometimes the people go to the river, they are the message called a danger, don't get into the water. They remove the t-shirt, cover the board, get into the water and face to the danger. It happens. Sometimes the careless is the most dangerous thing. The careless is the #1 reason that we make our life on a danger. So you guys can see these kind of things in the pool and the pool decks. Shallow water, don't dive, no run, slippery water. If you see the crocodiles, danger currents, the red danger, no swim, jellyfish, rip currents. These are most of the things that relevant to the water. So before enter to the CPR session, do you guys have anything to ask from me about these basic things of the water? Anything you guys have to ask, any things about the precautions? About the prevention and the precautions before getting to the water. Anything you guys open to ask before we go into the CPR session?
Hi, good evening. I have a small doubt.
Yes.
When the floods are coming, that time the young teenagers and the youngsters are coming to help the people, so they don't know about the place.
Yes.
That how we can guide them or how we can help them.
Okay, the thing is, that's what we call the lack of knowledge and the local knowledge. Because if you know the place, if we let's say, may I know, so where are you speaking from? May I know where are you from, please?
I'm from Colombo, the Rover Scoutmaster.
Okay, sorry. So let's say if somebody is coming from okay, I did my life-saving location also Mount Lavinia, most of it. So if we going somewhere, okay, to do the rescues and all, if I'm going somewhere I haven't know. So first thing is, if there is the people who know about more about the area, we mean according to Sri Lanka, so the Grama Sevaka, or the police person who at the area, or someone who's doing the social activity persons who know about the geolocation, about the area. So if somebody is come to the help to the people, so very first thing is, as a villager, you can tell them, okay, this is the area and this is the place, how the play of this, and what is the depth, or is there any hazards, maybe there is so many walls, houses, or it is a plant, or it is now this area is covered from the water, but it is the downward, it is a forest former. So we can give that knowledge from them. And as well as if we are a person who going to support to them, and if we are a person who going to support to other people, my first thing is I need to speak to a villager. Okay, we came from here, we need to support you guys. We have these kind of equipments. We have the boats, we have motor boats, we have floating boats, we have the paddle boats. So where we can go, what is the best route, what are the things here are there. So we need to take that knowledge, and as a villagers, we need to give that knowledge. So that is the best thing. Hope my answer is enough.
Yes, thank you.
Welcome. Any other questions? Any other questions? Because we need to move to CPR, and it is totally on theory, and I like to do a small practical session with you guys. So before we go to the CPR session, I can give you another 2-3 minutes to ask anything about the prevention and drowning prevention and water safety, because precautions and prevention things. Anyone, ask anything. There is nothing right or wrong. We came to share the knowledge, share the ideas, so I can get some of the ideas from you guys as well as, and I really like to take it to me, and if there is any doubts about what I'm talking, I really like to clear it before end of the session. That's why I want to do it. There are hundreds of people just ask the questions. I was told there will be a massive question session. I don't know. Even if you are person take, there are 100 incidents. If you guys can talk.
Hello.
Hi, Dinu Jaya.
Volunteer lifeguard.
Sorry, Dinu Jaya.
Can I become a volunteer lifeguard?
Yes, you can become, but we have a process. Before end of the session, I will give a brief discussion, a brief idea how to become a lifesaver and how to join with Sri Lanka Life Saving. Thank you, Danuje. I will answer it end of the session. Is that okay?
Okay.
Okay. Thank you. Okay, then I will start the second session of the and the most important thing somebody to learn in our life, because what we learning is a magic. You can give a life as somebody who doesn't have life. You can give a life to somebody's death. This is the magic. And I think I really appreciate to organize, and I have to thank for this organization organizing this session. This is one of the important thing each and everyone need to take to your life. So now I'm going to teach you that magic. We call this is CPR, cardiopulmonary resuscitation. So the very first thing is, I have to say, there are two deaths in your life, in your body. One is the brain death, other one is heart death. So if your heart is dead, you have another opportunity to live. There are 2 to 4 minutes time to start your brain cells getting damaged. If your brain dead, it is the end of the story. But if your heart was dead, we have an opportunity to make that person live again. So if there is a heart death, so we need to give external support to that heart, and we need to pump up it again. So that is the story, and that is the big picture. That is the picture around this CPR. So I'm going to share this. Guys, you can see the screen.
Yes, sir, we could see your screen.
About the CPR session.
Yes, sir.
Okay. Okay. Sorry. Is it clear to you guys? Can see it's in a clear, or it's not in a full screen? I'm sorry, it's not in a full screen, no?
Yes, sir, it is open in a browser window.
Okay. Sorry guys, I think we can go ahead this week. I'm sorry, I don't want to take much time to sort this technical issue. Is it okay? You guys can see, no?
Yes, sir, you may continue.
Okay, right. So as Sri Lanka Life Saving, we need to encourage people to learn CPR, and this is the most important thing what you have to learn in your life, because it is not only for you, for your bysiders are safe if you know CPR. The objective is it can help to adult, infant, child, anybody at your place, your parents, your family members, your friends, or anybody who in the outside of the road, somebody who need this support, you can give an help. So that's why we need to teach, and that's why we need to learn about the CPR. So once you start CPR, the major thing is you need to learn how your body works. So you have a heart, and there are arteries and ventricles. So the blood comes, your blood takes your oxygen to your heart, from your heart to your brains and your pulmonary. So this is the main things that we need to think. Okay, so your brain is working, your heart is stopped, we need to take this blood, oxygenate blood to your brain, and you need to keep your brain functions in properly until we are going to hospital or we need to give a medical assist until we need to keep it in externally. So that's why we need to learn the CPR. So you need to breathe. Once you breathe, you will take 21 of the oxygen from the air, because there are 21. So once you inhale, it is 21. But you need just you using a 5 to 6%, and you exhale nearly 16 to 17%. So that is the another thing we need to give to other person who can't breathe, and we need to give that support. And we need your heart, and we need to give a pump on it by externally, and we need to active. So approximately there are 7 lakhs or 700,000, 7 lakhs of cardiac arrest accidents in Europe and the around the world. If it is in Sri Lanka also, it is high rate of the cardiac arrest. Nowadays we can't predict it is in old people. Nowadays the younger people also getting cardiac arrest because of the lack of sports, lack of activities, or because of the food or poisoned air, many other reasons with there. Because that you have to think about your body, at least do small activities for your life. Do at least 10-20 minutes. You need to practice something to day for your life, to make your heart and your body very clean inside. So we call this is chain of survive. Early access. If somebody is on a hazard, it means if somebody is facing something, a drowning, fall on something, choking, something is on the throat, that we call the choking, or general heart attack or something, the cardiac arrest, something, because of the fear or any other thing, any other reason that you can reach somebody, someplace. If you can reach as soon as to the point, that's why we call the early access. The time of the victim, the danger, and how fast that we give the first aid is give that the highest percentage to save that life. Then early CPR. If you can give the CPR as soon as, then that percentage come more higher. And if you can use the defibrillator, defibrillator is the object that you can see every Europe and the other countries, everywhere. It is an object that we need to use to give the automated cardio shock to the people. But sometimes if you take an example, the Sri Lanka, you can't see that much of defibrillators unless a few places like the airport, World Trade Center, harbor, kind of a few places, and the hospitals. And the advanced life support, how fast that you can take him to the hospital, or how fast the ambulance or the EMT, emergency medical technicians, or senior first aider or senior life supportive can come and take that responsibility of the patient, is tell the highest and the lowest percentage of the saving that life. So these are the major keywords that we need to think and we need to keep in our mind before we enter to some action. The danger, response, send for help, airway, breathing, CPR, defibrillator or AED. These 7 letters we call the doctors ABCD. So you need to keep these words on your head. It is more important each and every time. Think again and again, remember it again and again, write somewhere, look at it and keep it always in your mind. Danger, response, send for help, airway, breathing, CPR, defibrillator. So this is more important, key 7 letters. So if we take the check for danger, what kind of a danger or what kind of hazard? If you see somebody is drowned or somebody is on land or somewhere on fallen, suddenly if you go and support him, it becomes an hazard. That's not the way. We don't know, there can be an electric shock or a poison or a gas attack or poison air. Again, it become a harm to us. So very first thing is you have to think about yourself before getting to the scenario. Okay, first you have to think about yourself. Then bysider, who is coming to support with you? Third, the victim, because he's already a casualty or he's already become a victim. So we have a good 2 lives, you and your bysider. We no need to put those 2 lives on a victim or to the danger because of 1 life. So that is, we need to take the precautions and we need to think very first about yourself, your bysiders. Third, we think about the patient. So check in the hazard. What kind of you can see from your eyes, smell from your nose. You feel if there is too warm, the people can get faint because of the warm. If you see the India, you have many messages. You will getting more news. The people die because of the heat. So those kind of, you will feel it. And once you see someone is drowning, your general sense, we call the common sense, you will know, okay, this person drowned or somebody is taking him out, so he's a drowned person. So you need to get an idea what kind of a danger was there. Then you have to think about what are the equipments you have, that we call the PPE, personal protection equipments. So the PPE is, what are the things that you can use? Okay, if I'm going to help this person, what are the things? Oh, I saw him getting fallen from somewhere. So I guess he have a spine damage. So I need to take something. So you need to get an idea. What are the things that you bring with you? And I will show some of the equipments as a lifesaver. What are the things that I'm keeping with me? Check the response. You have to, somebody is sleeping on the road. Suddenly go there and you try to give the CPR, then he will shout and you become a problem. So other thing is, we no need to give each and every person sorry. So most of the time we no need to guys, you can see my screen.
Yes, sir, we could see now.
So the checking the response is most important, because we now need to give a cardio support to every person. Because if somebody is fall down, or if somebody is in a heat stroke or something, so we can ask him first. We need to take in a response in, okay, what kind of a support that I need to give him. So first we can ask him, can you hear me? Hello. You have to shake his shoulders, and don't shake it fast, because if the patient have a spine damage or something, it become worse. Given a small pinch and given a small shake, the pinch is most the best. And always try to sit or talk to the patient's eyesight. Don't try to stand in the away from the patient's eyesight. Then he is trying to take his head. So the best thing is you have to come to his eyesight and speak. Then the movements are very less for the patient, and you have to take response. If he gives the response, if he gave a response, if he talk, if he's saying, yes, this is what happened to me and I want this kind of thing. Or if he's saying, okay, my legs are hurting, or just only my hand is paining. Or if he's saying, just only I fell down here, or just only I had a heat stroke, then you need to take that precautions for, and you need to give the assist. What are the things that you need to do the next? And the recovery position is the most best thing. If I will show the recovery position next. So after you take in the response, if the patient not giving the response, even the infant or child or adult, if he is not giving the response, we need to go to the CPR condition. So before that, if even if we talk to him, even if he is safe, the best thing is we need to call for the help or shout for the help. We need to shout for help and ask somebody to come and give you the support to sort this hazard or to help this person. It is a legally and a physically support for you if somebody is with you, because if somebody is come, then you know you can care about the patient and you can ask him to call for the ambulance or the paramedics or the hospital or the firefighters, whatever the place. You can speak, tell your bysider to speak. So what are the things that you need to tell him to say? Actually, most of the time, once we call, so we need to tell where the location, what is the incident, how many patients, and what is the easy access to that place. That is the best support to the ambulance or the paramedic team to getting set up before comes. So as in Sri Lanka, because I think there are majorities here in the Sri Lanka, so I have to tell, we are not that much high standards of the paramedics and ambulance services in our country. So we need to give a proper idea and a clear idea to the paramedic team or the medical assist. Once they come in with the ambulance, we can tell, okay, this person have this kind of injury, so they can set up. So that kind of support we can give to the ambulance team. So we need to think before call and telling everything. I think that's wasting the time and wasting the money as a country. So we need to give a clear idea to that team. This is the things that we need to do. Okay, how many patients, where the location, what is the reason, or the easy access. Those are the things that the most helpful to the paramedic or the ambulance team. And the most important and the very first thing, if the person is not giving response, and this is the open airway, we call chin lift or the head tilt and chin lift. We using that a pistol grip, something like this, and hold the chin, hold the head, and pull it up. I will show these things with the dummy. Before go to the dummy, I will first want to speak with you guys these theory parts. So hold the chin, hold the head, easily take it up, and you have to open his airway. Before open this airway, you have to check his nose and inside the mouth, because we don't know what kind of incident was there. maybe he's an old person, he have the fake tooth inside. So if it is go inside and it's hide, so we can't give the breath properly. We need to remove those things. We need to clear his nose. So those are the things we have to think. Oh, if he is vomit, or there are liquidity inside his mouth, so we need to turn off him and clean his mouth and take it back, and we need to give this cardio. So before that, we need to clean his mouth and clean the nose. We have to check and open the airway. Once you become the opening the airway, if it is an adult and a child, you need to pull it fully. You need to open his airway. But if it becomes an infant, you no need to pull his head back. Just leave it as a natural position. Otherwise, it become a damage to that kid, the infant's head, as well as his veins are very small, and once you pull it, it will become again, it's tiny. So our purpose is not achieving over there. So the best thing is leave him on hand and put his head in the natural position. So we spoke already the 4 letters: danger, response, shout for help, open airway. Then checking the breath. Once you pull his head, you need to check his breath. And we call this LLF. It means look, listen, and feel. You need to keep your you need to keep your ear and your cheeks on his mouth and nose, and you keep your eyes on his chest and keep your hand on his chest. And you need to take the feel of the warmth, and you need to take that feel of that up and down of his chest. If it is work, oh, you have to be there 10 seconds. Right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Within these 10 seconds, if there are no a proper 2 or 3 breaths, 3 or 4 breaths, it means he needs the cardio support. Even it is an irregular breath. Oh, if he is taking a hard, he needs that cardio support. Maybe you don't need to give that breath, but we need that cardio support because his heart is in irregular position. So keep them right. LLF, look from your eyes, listen from your ears, and feel from your hand and from cheeks about the breath of the patient. Then we, this is the what I speak. So if he is giving a breath, or if his breath is good, if he is talk, you can come for the recovery position. So you can put him to recovery position, because this is just on a visual. I can't show because I don't have somebody with me to take that assist to show how to put the recovery. I'm sorry for that. So this is, if you see these pictures, you can take an idea how to put on a recovery position. I will try to show some videos how to put on a recovery position. So after the if it is not the place to recover, even he's not giving up any kind of sound, this is the most important part. You have to give the CPR, cardiopulmonary resuscitation. How you giving a CPR? So each and everyone, you know where is your heart. The early days we saying it is on our left side, but actually it is not on our left side. It is on the middle of our body, and we call this area we call the sternum. It is a thick cartilage. We can tell it is on a plate in between our ribs. In between our ribcage, there are 8 ribs over there, and from those ribs, there in between these ribs there is the sternum over here. So underneath the sternum, the heart was there. Most of the heart is in middle of your chest, and most of the people it is a little to the left, but I think it's in a rare incident. It can be on a right also. So the best thing is you have to give compression in the middle, this sternum area. This is the best area. So generally, if you take the center of the body and cross over your chest from your eyesight, you can take a measurement where you need to keep your hand to give the compression. So the compression is the most important thing. So you need to give 30 heart compressions, 30 heart compressions in continuously, 30 heart compressions. And the best thing is you need to press that chest is 1/3 from your chest height. If you see as a dumb, so if you take it, this is the area that we calling that sternum. This is the place, sternum, and center of the body, center of the chest. So this is the place that you need to keep your hand. And if we take the 1/3 from the height of the chest, you need to compress this body. 1/3 from the height of the chest. So you need to keep your hands like this, and you have to compress it. I will show it how to do it. So get an idea. So from your palm. Nobody try to keep your fingers on the body. Always up your fingers, just only your palm on the chest, and you need to give an very tight. But always think, don't compress it more down. It become an injury to the organs. Don't do it lighter. It not necessary. I think it will be not a proper way. So the best thing is you have to keep a proper place, your hand, not more high or not more lower, and not more deeper and not more shorter. So you need to come with the exactly 1/3 from your chest height. So you need to compress that 1/3. Even a child, infant or adult, you need to compress 1/3 from the height of the chest. But difference is if you come up with an adult according to the body size, the adult, we giving the heart compression from your both hands. Child, you giving one from your one hand, and if it is become an infant, you need to give from your 2 fingers. 2 fingers for the infant, child 1 hand, adult 2 hands. And the depth is 1/3 from the chest height. Are we clear? Any questions until this position? Any questions? Guys, any questions? Yes, Nusrat, you can talk.
For infants and kids, do we have to do it 30 times or is it less than that?
Yes, good question. 30 is an exact number, even adult or child or infant. 30 is the number, because we come up that 30 is it's 30. We call this method we call is 30 to 2, because we giving a 30 heart compressions, 2 breaths. Okay, Nusrat. No, sir,
Yes,
go ahead.
understood. But in this current COVID context, are we supposed to give the breathing?
Yes, I
support?
will come to that point. I will come to that point. Thank you for the raise the question. I will come to that point. First I will want to say the 30 compressions and 2 breaths. Giving 30 hard compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1 breath, 2 breaths. Again, 1, 2, 3, 29, 30. Again, 1, 2, 3, 29, 30. So it is in a round circle and repeat it again and again. We generally believe you need to continue it 5 times. 30 hard compressions, 30 hard compressions, 2 breaths, 30 hard compressions, 2 breaths, 30 hard compression, 2 breaths, 32. For within 2 minutes, we need to do 5 rounds. We need to do 5 rounds. Unless if we can't give hard breath, at least we need to give 100 hard compressions per minute. 100 hard compressions per minute. Yes, there are 2 participants raised their hands. You can go ahead.
Sir,
Yes.
after 30 push-ups, if we didn't wake up, what should we do?
We need to continue. We need to continue. I will come to that point. We need to continue. If don't believe from your first 30, don't believe that from your first 30 compressions, the patient not getting the heart again work. So if from the first, give 1 second, if he's not wake up, we need to continue it again and again until a proper EMT, EMS, emergency medical technician, emergency medical support, ambulance, or until the patient take to the hospital. We need to continue it. We need to continue. If you keep your hands on a patient to start CPR, you can't go away until a proper medical assist or until the patient takes to the hospital. Your responsibility is there. So, okay, I gave 2-3 times, he's not wake up. Okay, I'm going bye-bye. No way, you can't do it. You have to go with the patient to the hospital. It's your responsibility. Okay, the next question. Yes, please, go ahead.
Excuse me, sir.
Yes.
Sir, if we don't know how to give properly, we can ask for help from a person around us.
Yes, exactly. That's what we call at the third point, DRS, the send for help. That, oh, shout for the help. Shout for the help means if you don't know how to do it, you can ask somebody. Okay, here somebody is fallen down. He is not breathing. I just check. Is there anybody who can give CPR? Please come and support him. That you can do it. That's the best thing. That's the best thing you can do it. If you don't know, just don't leave the patient. Just shout. Take the people near to him and ask somebody to give support. Good question. And that is the best thing that you can do it. Okay, for the CPR, for the next stage, what we have to do is 30 hard compressions, 2 breaths, going for these round circles, 32, 32, 32. If we can't give these 2 hard breaths because of this situation, or if you not feel good, okay, we don't know what kind of a situation with the patient. So if you don't have that proper confidence, or if you don't have a proper equipments to give that hard breaths to the patient, so leave that breath, just leave his head on head till, then it's eventually the air will be come up and down, because once we compress in the heart. So you have to continue the hard compressions. Normally the 100 compressions per minute you have to continue.
Excuse me, sir.
Yes.
Sir, they have invented a machine for that.
Yes, we so, but while we speak the CPR, because that machine is at some place. If it is on a hospital or house or inside in the ambulance or somewhere. But if you see somebody's okay, generally if I ask, if somebody get an cardiac arrest at your place, do you have a machine at your place?
No, sir.
Okay, then what you have to do?
Give the regular CPR.
Yes, exactly. That's why we teaching the CPR. So you have to do it by yourself until that ambulance or doctor or until the person who victim take into the hospital. We need to give that regular CPR. So we giving the breath. So breath is giving, it is bit harder to give because most of the valves have become getting low, getting stick. So we need to take a good breath and you have to blow it. 2 blows, 1 and check again, it's come back, 2. So likewise, and if it is an infant, you have to give a small puff. Don't give a big breath to the infant. So it will become an injured to the infant's internal organs. So just only a puff is enough for an infant. Generally if you don't have any equipment, so pinch your nose, pinch the nose, open the mouth, blow, close the mouth, open the nose, look at about his chest. If it is coming up and it's going down, again, close the nose, open the mouth, give the blow, close the nose, open the mouth, close the mouth, open the nose, and check. Again, start 30 compressions. So this is what we took, 30 heart compressions, 2 breaths. So we need to continue it. How many hours we have to give this? Sometimes if you start it, you need to give it until proper medical assist come to and take the responsible of the patient, or until the patient take to the hospital, until you can't give that compassion. 1, 2, 3, okay, now I can't give it. So nothing to do if you are alone. Or if you see, if you, the patient, 1, 2, 30, if he is weak, so you no need to give heart compressions. So you need to watch and wait. Oh, once we on a vehicle, we giving heart compressions. By the way, we giving heart compression. The victim is weak. So stop the heart compressions, watch him again, put him to the recovery position, or keep him a very rest position and watch him. If he is again his breath and he's go down, again start CPR. Again start CPR. Because we can't guess that patient is die, because we are not a doctor. I am not a doctor. So the last wish is, I want to wake this up. I want to give this life to this person. That is my ultimate wish. So I have to fight for that ultimate wish. So unless if the doctor or proper EMT, emergency medical technician come and say, okay, we can't help, he's gone. Until that, we have to fight. 1, 2, 3, okay, now I can't give it. So nothing to do. If you are alone, or if you, the patient, 1, 2, 3, okay, now I can't give it. So until that, we have to fight. So this is defibrillator. Defibrillator is another equipment. We need to give the shock. Each and every instruction is given from the defibrillator. It says, okay, once you open on the defibrillator, it says, okay, now this is what you have to do. Clear the patient. Touch the pads. Okay. Attach the pads. The correct positions. It will be indicate and show. After that, plug it to the machine. Start. First they say, okay, clear everything. Give the shock. Start CPR. That's what it is going. So that's how it is continuing. So defibrillator is an external supportive equipment. So if you have any kind of a place, you can use it, unless everything instructions is inside the defibrillator. You no need to worry about it. Once you, in the developed countries, if you take the defibrillator out from that position, it gives an alarm, and the closest paramedic or the ambulance service will get that indicator. So they will access to that place where you remove that defibrillator. So generally what we speak is these are the this chart gives everything what we speak until right now. For very first thing is we need to head tilt or chin up. Head tilt is full for the adult and a child. The natural position for the infant. Breath is rise of the heart. But if you see, if the rise is tummy, if the belly is rises, it means your breath is wrong or your breath is more. So if you're giving more breaths, and if his belly is getting up, most of the time the victim will put the vomit, or the liquidity is coming out. So because of that, you need to give just only a breath until his heart comes up. That's all. The compression of the depth is 1/3 from the height of the chest. Compression point is sternum. Visually you can see, okay, where is the place? You have that idea. For the adult, 2 hands. Child, it will become a 1 hand mostly, or 2 hands, because you have to see, okay, according to the body size. According to body size, we can decide the 1 hand enough, or we can go for a 2 hands. But anyway, if it is an infant, just only 2 fingers. Okay. Any question, guys? Before I will go to the practical session, I want to show it how to do it. Any questions you guys have to ask? Any questions, guys? Any questions until right now?
Excuse me, sir.
Yes.
Sir, when can we give CPR? That was a question when you told that to me.
Sorry, I didn't get it too.
Sir, when can we use CPR?
When can you use CPR?
Yes, sir.
Okay. That's what I very first I told, if you can hear, if there is someone on a cardiac arrest or someone fell down somewhere, if you go for a disaster, or if you go for to help someone who's seen fall down, or someone is not speaking, or someone is drowned, or a shock or current or some kind of a disaster over there. Or if you see somebody is down or not doing any activity on any actions on his body, then you can give a CPR, but first you have to check danger, then you need to take the response, then send for help or shout for the help. After that, you from first 2 points you have to think very first. After that, you can go for the CPR unless he doesn't have the proper breath, because we speak danger, checking danger, okay, all good, safe, response, the patient is not giving any response, then shout for the help. Okay, now already you can give the CPR, check the breath. If he is getting breath, if he is breathing, if his breath is proper, you no need to give the heart compression. So you can put him to the recovery position or rest position and leave him. Once you check the breath, if he is not giving any action, if his or her breath is not on a proper way, you need to give the cardiac external, means CPR. Any questions? Any others? Guys, anything else you have to ask? I have no idea, because I believe just only 2 things I have to think, you guys. Okay, everybody get a good understanding how to give the CPR, or nobody got anything. That's only 2 things I have to think, because unless if you guys are not talking, because very first thing is I have to say this is just not a theory session, and if you know the theory, or if you have all the theories on your mind, you can't do it. So guys, please clear if there is any pinch, if you have a doubt for any kind of thing, a pinch of thing, please clear it, because we going to deal with a man's life, a people's life. This is so help, or this can be a harm to a person. So that's why I want to say, please, if you have any doubts, please clear it. Okay, you can see the small, the 4 segments at the what? Yes, Anthony. Just go ahead. Anthony, you can speak now.
Okay, sir. Hello, sir. If the victim is wake up, can we give some drinks or any foods to him?
No way. Good question. And the answer is no. Don't give anything unless just only what you have to do, take a wet something, wet a tissue or a fabric, just wet, and put on his lips and keep his lips wet. That's so enough, because we don't know what kind of hazards that internally he have. So we need to take him as soon as to the hospital. If the doctor needs to take to him to operation or the checkups or something, so the best thing is we need to keep his tummy is free, and we don't know according to his allergies or what kind of thing. So don't take that risk. Just only take a wet, keep a wet something, put on his lips and make his lips. That's enough. But you have to do the very first thing is take him to the hospital. It is must. Anything else? I saw some other questions. Yes, Dinuka, go ahead. Dinuka?
Sir, we can give we can check pulse rate also, no?
Can check, but if you don't know how to take the proper pulse, you trying to take his pulse, you trying to take the pulse, but if you don't know how to take it, that's also time wasting to give the CPR, or it gets later to give the CPR. So because sometimes if you don't know how to do it, it takes so much of time. That seconds also, we think it is can be a small harm. So according to the Australian life-saving methods, the checking pulse is not that much of compulsory. You can faster, you can go. But according to the US and the Red Cross systems, they checking the pulse and they trying to check the pulse. But so I'm not saying what is right or wrong, but you can, if you are good in checking the pulse, yes, please, you can go ahead. But if you think it takes so much of time, so you can skip it and you can go for the next stage. That's no worries. Yes, Onel. Onel?
Yes, sir. If there's a patient who needs to treated with CPR, but
yes,
if he has a damaged first cage, what do you have to do?
Sorry, I didn't get you, Onel. Please.
If there's a person who need to be treated with CPR,
yes,
and he has a damaged first cage, what we have to do?
Okay. What kind of damage?
It means broke the.
Okay, accident. Okay, if we think okay, his hand is okay, he met with an accident and he's unconscious. The patient is unconscious, so we need to give the CPR. But he has a broken hand. So the most important thing is the unconscious patient, to protect his brain. That is the most important thing. If you're trying to figure his hand and if you're going to treat his hand, if you not think about his brain, if his brain dies, that's no point to treating his hand. The person who is taken to the hospital, if his brain is alive, then doctor can treat his hand. Or the worst scenario, he will lose his hand, but he keep his life. And the second thing is, we can do, if we have a proper supportive staff, or somebody is in with us, or there's a massive bleeding, his hand is broken and it is removed from his body, and there's a massive bleeding, you can ask someone to keep a proper fabric or a clean fabric, or put on it and tight it tighter and stop that bleeding. But if you know how to give the CPR, your most priority is to give in the cardio. While you're giving the support, the other person can put that dressing to his hand and stop the bleeding. So that's the way we have to manage it. If you are alone over there, okay, if there is a massive bleeding, just put a dressing of it faster and you can do the CPR. That's no worries. According to the zero, because unless he is in a severe bleeding condition, okay, no worries, just give a Fight it as fast as you can. But don't forget the CPR. CPR is the most important, because neither thing is no point. Anything is become a no point unless if we can't keep his brain is alive. Okay. Anil, is that enough for the answer, or you need to clear something else? Anil?
Yes, that's okay, sir. Thank you.
Okay. This is if you come up for the patient managing. So these are the things that we need to think. So because how we put a recovery position, be ready for the CPR again. He needs, so always you have to keep your eyes on the patient. And if you can, if the patient is alive, unless going to if you're going with him to the hospital, give each and every things. Tell to the doctor what are the things that you did, how many times, how many minutes, where is he, what are the informations, where are the wounds over there, what did you do to the wounds. Each and every information, please submit it to the doctor. That's the best, because then doctor know what are the next treatment he needs to go. So why we because this is has to be the very first thing is sorry for that, I forgot you to say there are mainly 5 P's. We call 5 P's. Why we need to give that CPR? So preserve life. It means we need to keep that life, prevent further injuries. We need to protect that injury, or if we no need to take it to the worst level. Protect the unconscious. If the patient is unconscious, we need to make his brain in live, in giving external cardiac cardio massage, and keep his brain live. And the promote recovery. We need to take that person to recovery. Next is process the medicals, because we need to take him. It's our responsibility to take him to the doctor. Okay, I'm going to stop this slides, and I really like to show you guys a small practicals session with me. Hope you guys can see me. Okay, if you see, if this is the patient, what is the first thing we have to do? I really like if you guys can, if you have a pillow at your place, is with you, a pillow with you, please take a pillow near to you. I will give 2-3 minutes. Please take a pillow with you and keep it in front of like this, and get ready to do a small practical with me. I will give you guys 2-3 minutes. Just take a pillow. I think it is more practical than just listening and seeing what I'm doing. Okay, let's start it. Because before they start the session, you guys asked because of the quiet situation, And other conditions, if can be given breath to the people, or can we do it? So this is one of the best equipment we can use. We call it pocket mask. And it is something like this, and it's fixed to your nose. It's actually, we're keeping it on the patient's nose, and we have we can blow it. So this is one of proper life equipment supporting PPE, so that we can use. If you know, this is a bit expensive, but if you can try to keep it one with you, I think it's really a best supporting equipment for you guys. First, as we speak, first thing is danger. So before I want, if I see the patient, okay, I have to think about myself. Okay, there's a plug, oh, it's off. There is nothing over here. Okay, I'm clear. My bystanders are safe. I'm safe. Okay, now I can treat to the patient and move to the patient. Second thing is, first the danger, response. Take the response. Hello? Hello? Can you hear me? Hello? Open your eyes. Hello? Can you hear me? Can you hear me? Hello? Hello? No response. He's not giving response. So, danger, response, send for help. Okay, I need to take a rest. Okay, just I take a, okay, there's someone is over here. Okay, please call to the ambulance and tell this is a place and how there are one person is not giving. I'm trying to give in the CPR. So please ask from the ambulance to come over here. So send for help or shout for the help. Then DRSA, airway. Open the airway. Before open the airway, I'm checking his mouth. There's nothing. Clean the nose. Okay, fine. Okay, if this is an drownings, or if we see him drown and if take, definitely there are liquidity on his mouth. So keep your hand on shoulders and other hand on the hip. Turn over the patient. Clean it. So then the patient, clean it. Again, take the patient over here. Chin up. Once the chin up, we're using pistol grip. Holding here, holding the, but don't do it in fast. Don't do it in fast. Do slightly, slow and gently, nicely, slowly. Don't harm to the patient. Don't harm to the patient. Then open the airway, check for the breathing. 10 seconds, look, listen, feel. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No response, no either breath. Then I have to go for the CPR. Center of the body, cross over the chest, sternum, keep my hand. Always keep your full body weight to the chest. Your shoulder is always keeping the center of the chest. Keep the hands, but no fingers touching his body. Keep the hands 1/3 from the height of the chest. 30 circles, 32 breaths, 30 times. Okay, let's go. 1, 2, 3, 4, 5, 6, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Always keep your eye on the patient. Always keep your eye on the patient. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After 30, you need to give 2 breaths. If you don't have any equipment, and if you know it is safe to give breath, maybe somebody is your family, or it's your friend who is near with you. If you know, you can give the breath, as we say. His head is always chin up, close the nose, open the mouth. 1. Close the mouth, open the nose. 2. Again, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If it is in a situation, if you have any equipment, use the equipment, don't think twice. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you have to continue with until 5 times, and the 5 times, then again check LLF, again 5 times, check LLF. Continue with until he is going to the hospital. So additional point I will going to say you guys, if this is a pregnant lady, you need to think twice, and it is bit a hard situation to manage a pregnant lady, but we need to do something. So the best is you need to bring some pad or something and keep it slightly on her bum, on her butt, and make her to slightly to the left. Then again start CPR normally. Just only what you have to keep something, a pad on her right butt, and you have to put her slightly to the left and start CPR. That's all. And if this is an child, use one hand, same thing, 32, but from your one hand, 1/3. And this is infant. Take to the hand, just using your 2 fingers. Push. Push. Puff. 30. Again, push. 30. 2 fingers. 1, 2. Push. 30. That's it. So those are the things that you have to practice. If you have a pillow with you, just keep your hand. Right? Continue with. At least try 100 times per 1 minute. 100 times per 1 minute. Oh, within 24 seconds, 30 heart compressions and 2 breaths within 24 seconds. You have to try it. So that is the CPR practicals, what you have to do with a person. So that is the practically I can show. And the thing is, keep that 7 letters, always remember. D, R, S, A, B, C, D. danger, response, shout for help, airway, breathing, CPR, defibrillator. If you have the defibrillator, so keep the defibrillator, attach the pads, leave from the patient, give the shock, then it will be asked, okay, give this, continue the CPR, give breaths, CPR, again, shock. It will be continuously doing it with you can try it with the machine. So that's what is the things you have to do. If you don't have a pocket mask or if you don't have a proper PPE, personal protecting equipments, okay, leave the breaths, leave it, but do his head tilt. It is most important thing. It's very important. Open the airway. Open the airway is very important. So open the airway, leave it, and continue the heart compressions from 1 to 100 in continuously. That's fine. So, guys, anything else you want to see, or you want to carry me again one round? Or that's enough, or we can go for the question and answer session. Question and answer the session.
Sir, if the person is not breathing and no responses, can we consider like she's dead?
No, we can't consider it death because you and me are not doctors. If somebody is at the point, that's the moment we need to give the CPR. That's the moment we need to start the CPR. Until a doctor or EMT, emergency medical technician, say, okay, we can't help, she or he is gone, that's the moment we stop this. Our ultimate goal is to bring this person live again. So we can't decide or we can't guess someone is dead. Are we clear? Are we clear? Hello?
Yes, sir.
Okay. Is there anyone to ask anything?
Hello, I have a small doubt.
Yeah.
I don't know whether it's out of subject. The guys, they are going for a jungle hike. That time the snake is bite him. So he's in unconscious. That time, how we can handle it and how we can do this CPR? Because when the snake is bite, it's not harm, but his trigger and he went to the unconscious that time.
So we need to check whether first it is unconscious or he is just in a dizzy level, because sometimes the people become dizzy. But it's something that we call this is the unconscious, and conscious is this. Unconscious means what we figuring is his heart, and the heart is stopped. But sometimes if it is a high venomed snake, maybe it will be harm to his heart. So we have to think, we need to give the heart compressions if its heart is stopped. Because if we think, okay, the venom is going to the body and it becomes an harm, or if it is heart is stopped, it means already the venom is going to his heart. So there are some doubtful situations, because if you come for the very established countries, Australia, very developed countries, sometimes they say don't wash the hands with the don't wash the venom. So bring the patient with the venom and they will check the venom and they give the precautions as soon as as fast as, but in Sri Lanka, we can't do it. So we have to think twice. So the best thing is, if you see the animal, or if you see the snake, or which one is, so the best is you have to think what type of the conscious or unconscious he is, because sometimes he's because of the afraid he's faint. The faint and unconscious is two different situations. Sometimes we need to figure it if he is at a faint or he's unconscious. So within that faint and unconscious condition makes us the next stage and the next first stage what we need to treat. Is that okay? Hopefully you guys need anything else with the dummy. Hope it's okay for everyone. So sorry, anything else you guys need to know from the CPR? Any questions?
All right, sir. It seems like there's no any questions, and
Yep.
thank you very much, sir. I hope you all, I hope everyone enjoyed your wonderful presentation. And now it's time for the Q&A session. And before that, reminder to fill your details in the link given in the chat box. Your participation. So to move on with the Q&A session, I would like to invite Jaini. Jaini, over to you.
Thank you, Lakindu. Okay, now let's move on to the Q&A session. Before we start, you all can put any questions you have in the slider link provided in the chat. We will be directing those questions to the Q&A session shortly. So moving on, so we have like 5 and 6 questions.
Okay.
The first one is, to what extent should I be competent in swimming, and what are the other qualities I need to have to follow a life-saving course to be a trained lifesaver? Okay,
there are two. Okay, I remember a former somebody's asked how to become a lifesaver. So this is, to become a lifesaver with Sri Lanka Life Saving, very first thing is you no need to know swimming. Life saving is something is not swimming. Swimming and life saving, it's just only for the sea. To become an elite lifesaver and a professional lifesaver, you need the swimming qualification. So we are starting from the basic life saving, then we going for the intermediate, then we going for the junior lifesaver. After that, we coming up our professional life-saving qualifications, pool lifeguard, surf lifeguard. Surf lifeguard means the bronze medal. After that, the silver medal and gold medal. Those are the elite and professional qualifications. So if you are in a very young age, if you willing to be a lifesaver, you can join with Sri Lanka Life Saving and you can take the life-saving knowledge. While you take in the life-saving knowledge, you can improve your swimming ability if you want to be a light or a professional lifesaver. If you become a professional lifesaver, if you want to be a professional lifesaver, you need to swim at least 400 meters. And 400 meters less than 9 minutes in the pool, as well as you need to practice to swim in the sea with the waves. So if you swim with the waves, you can learn, you need to get both knowledge, the surf and the, we call it still water swimming, and the surf swimming. You need to practice both to become a proper and elite lifesaver. But to start life saving, you no need any swimming qualification. you just only the passion and willing to be a lifesaver. That's so enough.
Okay, sir. Moving on to the next question. Is it possible for a child to perform CPR?
Yes, but if he or she is age is above age is 14, that's age 14 is that we believe because you need to compress a big body, you need to compress it, so you need that fitness. So internationally they believe age 14 is the age that someone can manage that situation and give that compression strength. So that's why in the Sri Lanka Life Saving also, if you want to do a CPR session, you must be above age 14, you have to be.
Okay. The next question is, are there any occasions that we cannot perform breaths and CPR, like in case of an external bleeding or an internal bleeding?
Yes, the thing is, if you think if it is an accident and his chest area is fully damaged, his chest area is fully damaged, if you can't keep your hand and give the chest compression, or within an accident or some goes wrong, and if his jaw is fully damaged, you can't give a breath, so you can avoid at that situation. We are not allied first aiders. It means we are not senior first aid or EMT or paramedics. If you become a paramedic, if even the jaw is broke or something happened, the paramedic can cut his throat and put a straw and give the breath. But you need that practice as a paramedician. So you have to become a paramedic. Paramedic is something a level of a doctor. So unless in the initial stage, as a lifesaver, if you feel okay, this condition, if I can't manage, that's no worries, leave the condition, you can keep that situation away from you. If something is in a bleeding, a massive bleeding, that's we call PPE. We need to put pressure, so PER, put a dressing on his that bleeding point, pressure, elevation, and rest, or keep the pressure with the dressing. After that, try to give the next first aid or the CPR. You can continue it, but keep your mind, the very first, the most important thing is CPR than any other thing.
Okay, so thank you. The next question, are there any precautions we should take when performing CPR because of COVID-19?
Yeah, that's what the COVID is harm for everybody. We don't know the situation. So my opinion is, if you don't have a proper equipment, please don't give the breaths. That's my personal opinion. Don't give breaths. But if you can perform from the cardio, compressing, heart massage, yes, please go ahead. But always you can wear the gloves, you can wear the mask and everything, you can give the heart compressions. Think about yourself. Your life is most important. First, number one is your life. So think about it. That's no worries. According to the situation, you can decide. You can give the CPR or avoiding the CPR. It's up to you. But if you are a lifesaver, if you become a professional lifesaver at my level, yes, sometimes you have to give the CPR with the restricted conditions. but you need to try, but you have to become at a professional level, then you know how to manage the situation. But if you're not, please don't take the hazard or the risk. It's totally fine.
Okay. The last question, is it okay to give CPR if the patient is still breathing, but if he's unconscious?
Yes, that's what I say. If he or she, the breath is irregular, oh, that condition, if he or she is continuing, you can give the heart compression until it becomes a regular system. But you no need to give the breath, just only heart compression is enough.
Okay, thank you, sir. Seems like that's all the questions we have for the Q&A session. Thank you, sir. Over to you, Lakindu.
Thank you, Jayani. Next, I would like to invite Jitme to do the vote of thanks.
Thank you, Lakindu. Good evening, everyone. I consider it as my great pleasure and honor to deliver the word of thanks on behalf of you. First of all, I'd like to pay my sincere gratitude to today's speaker, Mr. Samith Thilina, Senior Instructor of Sri Lanka Life Saving, who duly accepted our invitation and delivered a remarkable session on life saving. Then, I'd specially thank Mr. Sri Lanka Silva, Assistant Chief Commissioner, Rover and IT of Sri Lanka Scouts Association, as well as Dr. Asanka Eriava, National Headquarters Commissioner, who was the founder Rover Scout Master of Ethugalpura Pioneers District Rover Crew, for the immense guidance and inspiration you provided for us to make this webinar a success. I'd also like to extend my thanks to the District Commissioner of Kurunegala District Scout Association, Mr. U.B. Disanayaka, and Assistant District Commissioner, Rover, Mr. Kulatilaka Vijayasundara, for their well wishes. I'd convey my heartiest gratitude to our beloved Rover Scout Master of Ethugalpura Pioneers District Rover Crew, Mr. Chanaka Halegola, as well as Rover Scout Mistress of Ethugalpura Pioneers Girls District Rover Crew, Mrs. E.W. Aryamala, for your guidance and support provided for us in organizing this webinar. It's a great fault of me if I forgot to thank my dear fellow Rover Scouts of Ethugalpura Pioneers District Rover Crew who are behind the scenes. Without your courage and dedication, there won't be any successful webinar like this. Last but not least, I'd like to thank all the participants who joined with us to make this webinar a success. I hope you could grab a better knowledge on life-saving skills from today's session and hope you will be with us for the rest of the webinars. Thank you. Over to you, Lakindu.
Thank you very much, Jitme. Finally, I would like to request you all to turn on your cameras to take a photograph.
Lakindu, can I give a small message, please?
Yes, sir, sure. Okay,
I think this is the end of this session, and thank you very much to inviting us as a life saving on behalf of the Life Saving Association to Ethugalpura Scouts Rovers. Because this is I think this is a great opportunity to the public as well as the other scouts who willing to be a lifesaver or who willing to be a first first aider or first responder, yes, please join with us with the Sri Lanka Life Saving. I want to give a small message. Please come and join with Life Saving Facebook and put a like to us, give a rate to us, and join with us. You can get more information, messages, and the other knowledge. What are the sessions that we conducting and being the following other sessions. Please join with us at Sri Lanka Life Saving on the Facebook. Thank you so much to all the scouts and the participants being with us, with me for this 2 hours session. Thank you so much.
Thank you very much, sir. Can everyone turn on their camera to take a photograph? Okay, thank you very much everyone for all those who participated today. Before winding up the session, I would like to request you to like our Facebook page and hope you to see you all in the webinar tomorrow on counseling skills, and hope you all stay safe and a very good night.
Thank you very much.